All right, it's Notes from No More Hygiene, and I have a special guest today, Dr. Sandra Armstrong, who is a board-certified pediatric dentist who practices in my hometown, Southlake, Texas. Sandra, welcome.
Thank you. Thanks for having me.
And I specifically wanted you to share today something you shared with me at one of our recent courses that has to do with pediatric dentistry and oral health that every parent should know. I learned a lot. And as you know, I have a child or two or three or four. And this was really mind expanding for me. So tell us about the first 5 years and why that's so important in a child's life as far as their oral health.
I would be happy to. And I really hope the general dentist and others, hygienists that are listening, can take this to heart and use it in their practice to improve outcomes for all their patients and families. But in pediatric dentistry, we request, and it is the AAPD as well as the Board of Pediatric Dentistry, as well as the American Academy of Pediatrics, recommend, and we educate our parents that we want to see children after the age of either 1 year or when the first tooth erupts. Okay. Because that's when the tooth starts colonizing with the bacteria, Strep mutans, which causes cavities for the rest of your life. So if we can start combating that, the minute the hard surface, the tissue comes in, we can start combating that by A, brushing the tooth, but B, getting professional varnish applied by a dental provider. We can keep the bad strep mutans that are very virulent, that cause gross decay in children, which later leads to adults. We can keep that at bay. So it is absolutely the single most important part of preventive dentistry that can take us through the rest of our lives.
So how do you respond to a parent who says, well, they're just baby teeth, they're going to come out anyway, so it doesn't matter?
The baby teeth, if we can put varnish on baby teeth and establish the good bacteria, the good Streptococcus mutans, and the way that happens is varnish kills the bad stuff and it makes the enamel harder. But if we can do that routinely every 3 to 6 months on our patients up until the age of 5 to 6, we're setting those patients up for success so they can remain cavity-free for life. There is what we call a window of infectivity, okay, where children they're very prone to acquiring bad bacteria from cavity-prone other people. Daycares, nannies, parents that are cavity prone, and there's other ways that we can talk about how we can keep that transmission from happening.
Oh, you mean the babysitter shouldn't be cleaning the binky with, sticking it in their mouth and then
never. Or eating, lick the ice cream cone. Mm-hmm. You can always eat after your child. We just don't want your child to be eating after you. And we do know that children, there are many vectors. Children in daycares, they slobber on toys. So it's not always the bacteria that gets transmitted in the home. It's also other areas of access, and or an older child can even bring it home. It is truly an infection, right? An infection of strep mutans, and that's what we're combating. And the studies show us that if we can prevent that from taking force, then, like I said, you can be cavity-free for life.
Which is huge. First 5 years. Now, late breaking news that I just discovered, I'm not sure exactly when this happened. The AMA has approved an insurance code for pediatricians, not pediatric dentists, but pediatricians, to administer fluoride and even silver diamine fluoride.
Yes, sir, that's correct. And we encourage them and we try to educate our pediatricians. And one of the reasons, Steve, that a lot of general dentists don't do infant care is because they cry. Well, children cry when they get their diaper changed, but we change the diaper, right? Or we lose
Right.
friends. So we want them, all it takes is brushing the tooth, putting that stuff on your finger, rubbing it on the teeth, not brushing it off until tomorrow. They can have the mothers bring their infants into their office, sit in their lap. It's a 60-second procedure. The hygienist can do it. There's insurance codes. It's reimbursable by all insurance companies, dental, but also in the medical field as well.
Okay, great verbal skill. Tell us about strep tooth.
Strep tooth is what they are currently calling it to appeal to the parents to understand that strep occurs once a tooth comes in. Strep has to have a hard surface to bind to. That's when the caries process can start to begin. So strep and teeth go together. We're calling it strep tooth because that's an indicator that the two go together. We got to get rid of one of them. We don't want to get rid of the tooth. We want to get rid of the strep. But think of it that way, as a very dynamic infection, if you will, and that it can be managed and prevented.
That got my attention. If you told me that my child has strep tooth, that's a lot different than a cavity.
And every child has it. Every child has it.
It's all about the bacteria, and it's all about cultivating the healthy bacteria and warding off the bad guys early on.
Absolutely.
Perfect. Sandra, you are a great communicator, concise to the point, and great tips for parents. And you just added some production to everybody's practice who's watching this.
If I was a general dentist, I would be inviting every child into my office and varnishing them and helping us. And Steve, I have to say one thing. Only 16% of children are getting varnish applied to their teeth before the age of 5.
16%. So there's plenty of upside here.
Yes, sir. There's a lot to be done.
So chances are any patient you have in your practice that has a child under 5, you're going to have an 80% chance that they have not gotten the treatment they need.
That's correct.
Great opportunity. Bring the kids along.
That's right.
Perfect. Sandra, thanks for the insights. Thank you for the bacteria insight into pediatric dentistry, but also for all of us. I guess anybody who has a cavity's got strep tooth, right?
Yes, sir.
Perfect. Thank you.
Yes, sir. Happy holidays.